I'd like to bring it all together, and I'd like to show you what we're doing here as we focus on the consumer experience. We started with registration and scheduling and some of the consumer portal. You're going to see that, and I want to show you what we've been working on to address your workforce challenges, streamline operations, reduce costs, and meet your patients' expectations, which are consumer-grade applications. So, with that, we are going to show you how the system works. This is the new system that works through the eyes of a patient, a front office worker, and a doctor. So I'd like to invite Julie Smith and Dr. David Feinberg to the stage to help out. Julie is going to be our patient. David, who is an actual doctor, is going to play the front office worker, and then we're going to see him as Julie's primary care provider, Dr. Feinberg, within the clinic. Okay, so to set the stage, Julie has just moved to the area, and she wants to establish a primary care provider with a clinic near her house. Julie calls the clinic to schedule an appointment, and because it's her first time at this clinic, she needs to register. When the front desk receives Julie's call, they'll log in the system to create a new patient. Historically, the person registering a new patient would need to ask for all her details. Now, David simply asks for the bare minimum information. He asks for her first name, last name, date of birth, and cell phone number. That's all he needs to get Julie scheduled. She'll be able to complete the registration on her own time. With this new approach, the time the front office staff spends on administrative tasks is reduced. The experience is more like what Julie has come to expect from her engagement across other industries. It's paperless and it's simple. And she's empowered to complete her personal information on her own time and in private. David sends Julie a link to complete her registration, and since she's already on the phone, she'll go ahead and schedule her initial appointment with the front desk. In the future, she can also schedule appointments by herself online. Let's walk through the self-registration process with Julie. Julie's received the registration link via text. She can also access this link in her patient portal, and Julie's going to provide her identifying information to verify who she is, and she enters some additional information as well. One of the first things she'll need to do is add her identification. She can do that right from her mobile phone, either taking a photo or using saved photos of her ID. She conveniently keeps saved images of her cards in her photo library that she's going to upload. The OCI Document Understanding Service is going to recognize all the fields and automatically populate them with information from the front of her ID. The barcode scanning service will fill in the information from the back of the ID that may be missing or unavailable from the front of the card. She reviews the information automatically to make sure that it's captured correctly, and these cards will now be saved securely in Julie's file. So at her next visit, she simply will just have to review and verify the information or make any updates that may be necessary. Now, Julie needs to add her insurance information. So she uploads a photo of the front of her insurance card and a photo of the back of her insurance card. Once again, it's the OCI Document Understanding Service that's going to autofill all of these fields. So Julie's completed this information conveniently at home on her phone. She could have taken a photo of the cards using her phone or used an in-office tablet. Now she's going to review the HIPAA agreement and any other forms that the clinic needs. She signs electronically, and now she's fully registered. So moving along, now time has passed, and Julie's now an established patient with the clinic and with Dr. Feinberg. Last week, she was diagnosed with community-acquired pneumonia and given antibiotics. Dr. Feinberg is seeing Julie today to ensure her antibiotic regimen is effective and to follow up on chronic conditions. So she receives a message in her patient portal to schedule this follow-up appointment. And now that Julie is an existing patient with the clinic, she can schedule this follow-up appointment on her own. Let's walk through the self-scheduling process with Julie. So she enters her username and password to pull up a list of appointment options. And she's going to select the one that best fits her schedule. She can add this directly to her calendar right from the mobile device. Today is Julie's follow-up visit, so I'd like to first show you our new patient tracker that the front office staff can use to understand the location and status of each patient they'll see that day. These shifts on the patient tracker happen automatically, which allow for a quick accurate view of how the office is flowing. This is the new patient tracker. On the day of her appointment, Julie can check in multiple ways. She can do so from the link on her mobile phone, she can scan a QR code in the office, or she can even interact with a tablet that we'll place at the front desk. In the future, we can imagine integrating financial information so that Julie is able to pay her copay through the coming Oracle Health Payments application. And as soon as Julie is checked in, her information automatically shows up on the patient tracker. Now, we're ready for Julie's in-person visit with Dr. Feinberg, and after checking in and arriving, the nurse takes her into an exam room and checks her vitals. Dr. Feinberg is finishing up a previous appointment before moving to Julie's room. He's going to use the new Oracle Clinical Digital Assistant for his pre-visit activities. Instead of asking Julie about her medical history or why she's here, he will review her chart using AI and voice technologies. The system uses biometrics to authenticate Dr. Feinberg, which is integrated with the EHR self-sign-on. This allows him to get up to speed quickly, even while walking from one exam room to the next. So let's listen as Dr. Feinberg leaves one patient room on his way to the next appointment, which is Julie's. He'll use various voice commands to find the most relevant information.
Hey, Oracle, show me my next 3 appointments.
Here are your next 3 appointments. To open the patient summary, say the number or patient name.
Open Julie Smith.
Here's the summary for Julie Smith.
Read it out to me.
Julie Smith is a 41-year-old female who was last seen on Friday, September 8th at 4:30 p.m. who has active problems of benign essential hypertension, hypercholesterolemia, and type 2 diabetes mellitus.
Show HCC.
Here's the list of eligible HCCs.
Add HCC to the problem list. Show me my last note.
Here's your last note for Julie Smith. You can ask me to summarize the note or read a section.
Show me her vitals.
Here are their vitals. You can say a name to see the history.
Blood pressure.
Here are the vitals for blood pressure.
Close.
So what we just heard and saw was Dr. Feinberg using voice commands to pull up the current and past information about his patient, including the vitals that the nurse just collected. We've also embedded AI to generate a succinct patient narrative, pulling details from various parts of the chart. Dr. Feinberg was able to familiarize himself with the patient chart more quickly than having to search for patient notes or results or medications. Notice there were 0 clicks in the entire interaction, not even to sign on, because his voice is what authenticated him into the system. Additionally, the system used data from our population health platform in a couple ways. It notified Dr. Feinberg that Julie qualifies for a registry. The system read through Julie's chart and brought together all types of data to determine she may qualify for a certain HCC code. This will enable providers to add patients to groups based on diagnoses or conditions to better manage their care. It also identified Julie as at risk for food insecurity. This type of information is crucial to ensuring she has the resources she needs, like healthy food, to manage her health. Dr. Feinberg is now ready to see Julie for her in-person visit. After knocking, he enters the room where Julie is waiting. At her initial visit, Julie gave permission to have her visits recorded. Now, at this follow-up appointment, Dr. Feinberg begins listener mode on our Oracle Clinical Digital Assistant.
Hey, Oracle, start recording. Hey, Julie, how are you feeling? How's the cough? How's everything going?
Dr. Feinberg follows up on Julie's pneumonia, diabetes, and diet. They also talk about how her kids are doing and what trips she's planned later this year. As you can see throughout the interaction, Dr. Feinberg is spending quality time with his patient, looking at and speaking directly to Julie. He's not buried in a computer looking for information. Additionally, our clinical digital assistant does more than capture the conversation in the background. It also participates in the interaction. So when reviewing Julie's labs, Dr. Feinberg noticed Julie's blood sugars have been running a little high. He'd like to go over this information with her.
Okay, Julie, let's take a look at your blood sugars because they've been trending a little high. Hey, Oracle, can you show me Julie's last 3 hemoglobin A1Cs?
Dr. Feinberg quickly has the information he needs to show Julie how her values are trending without guessing or assuming. He has the data right at his fingertips on his mobile device when he needs it. We'll now jump back into the conversation to hear Dr. Feinberg sum up Julie's visit.
All right, Julie, I'm glad that the pneumonia is resolving, but the blood sugars have been increasing, so there's a few things I want to do. I'd like to refer you to our dietitian to get you enrolled in our food prescription program, and we're going to have to increase the metformin, as we discussed. I'd like you to come back in about 3 months and get a hemoglobin A1C before that visit, and we'll set all that up for you. Hey, Oracle, stop recording.
During that visit, Dr. Feinberg and Julie had a full conversation. While they were talking, the clinical digital assistant was running in the background. It pulled out the clinically relevant information and generated a draft note for the doctor with proposed actions to review and sign. As you can see on the screen, the actions are now displayed for Dr. Feinberg to review, edit, and sign.
Hey, Oracle, order metformin 850 milligrams, 1 POBID.
Updating the current order to metformin 850 milligrams. You can change this order or sign it.
Dispense 93 refills.
I've changed the dispense to 90 and refills to 3.
Sign it.
The order for metformin is signed.
Review generated note.
Here's the draft note for Julie Smith.
Sign it.
The note for Julie Smith is signed.
Send Julie an email in 1 week asking how she's doing and whether she's got enrolled in the food prescription program.
Your reminder has been set to show up on Monday, September 25th at 9 a.m.
Dr. Feinberg has completed his visit with Julie. Oracle Clinical Digital Assistant has lessened his interaction with the EHR, saving in time and lowering his cognitive burden. Not only was each stage of the journey improved, but all pieces of the system are connected. As soon as Dr. Feinberg signs the note, Julie moves from in-room to checked out back in the patient tracker at the front desk. Julie can go to the checkout desk or simply leave the clinic. She'll receive a link on her mobile phone to complete checkout on her own, where she can download patient education or complete any necessary payments.
Hey, Mike, this is amazing. I mean, to be able to sit and talk with a patient, not touch the computer at all, like you almost didn't believe this would be possible in our lifetime. The demo I saw our team do on nursing, the nurse comes in the room, the patient has an infiltrated IV, just talks to the patient, change it, replace the IV, the note gets written with phlebitis. I mean, this is amazing.
Well, you know, this is, we spoke about this last year in Kansas City, David, about bringing together all the Cerner IP and the Oracle technology and really thinking about, you know, how do we improve outcomes for both patients and providers. And I hope that that gave everybody a little bit of a glimpse. I noticed you didn't have to put your pajamas on to do any of that.
Exactly, no
You were able to get it all
pajamas.
done there. And I do want to apologize. I told you no clicks, but I noticed you had to turn the power on.
Oh, there you go,
So
there you go.
You did have 1 click.